Hello, I'm Dr. Kathryn Hayward. I want to invite you to join our Living Whole online community. I'm a conventionally trained primary care internal medicine doctor, and I worked at Harvard Medical School and the Massachusetts General Hospital in Boston for 20 years. In that world, when somebody says the doctor is in, it means the doctor's in the office, available for patient visits. In Living Whole Online, we have an additional definition of the doctor is in, which is the doctor is in here. You may have heard the term inner healer or inner doctor. What does that mean? It means that we understand that our health is our responsibility, that we make choices, that we use our free will to choose what we need to do to live healthy lives. Living Whole Online is an education program. We offer you a new way of caring for yourself so you can develop skills that help you thrive and live with more joy and peace in your life. During my years working as a primary care doctor, I had the privilege of having patients confide in me that they were doing things that I had not learned about in the conventional medicine system. One gentleman is very memorable for me. He was an executive in a big company, and he was a runner. He had to run to manage his stress. He developed a heel spur, which you may know is a bony outgrowth of the heel, and it hurts to put pressure on it. So walking and running are very painful. I did for him what I knew to do from my conventional medicine training, which was to advise him to ice it, rest it, and take anti-inflammatory medications. It didn't get better, so then I referred him to an orthopedic colleague who gave him some cortisone injections, and even that did not help him. He became, understandably, more and more frustrated. He started running again because that was his way of managing stress, and then his opposite hip started to hurt. One day he came into my office and he was no longer limping, and he said to me, "Why didn't you tell me?" Tell you what? That acupuncture would help my symptoms. I could have gotten defensive. I could have dismissed the idea that acupuncture had made him better. Instead, I got curious, and after he left my office, I called the New England School of Acupuncture and said, "I just had a humbling experience, and I'd like to know what acupuncture can do for my patients." That led me to the dean of the acupuncture school, a Chinese physician who was practicing acupuncture in Boston. He invited me to spend a day with him, and that day changed my life. He allowed me to go into patient rooms prior to his entering them and ask people, "Why are you here having acupuncture?" And what I learned was they all had the same conditions that I was seeing in my medical office: headaches, chronic pain, sleep disturbances, depression, anxiety, high blood pressure, heart disease, diabetes, weight issues, cancer, immune system issues. They each had a similar story, which was that they needed more than they were receiving from the conventional medicine system, and so had tried acupuncture. And they were finding acupuncture helpful. The things I learned changed my way of talking to patients. In addition to all the ways I'd been trained to ask questions of patients, I added this question: "Are you doing anything for your health that you've not told me about?" This opened up really interesting conversations. People were doing all kinds of things that they had not usually told doctors about. I asked for the names of the practitioners that they were working with and then made appointments and experienced their work. Little by little, my view of what health and healing encompassed got broader and broader, and I realized that conventional medicine alone is not enough. To maximize our health, vitality, and well-being, we need to integrate and draw the best from the conventional medicine system, food, movement, mind, body, and spirit. These 4 disciplines unite to create integrative whole health. This beautiful living whole flower, comprised of 2 intertwined infinity signs, represents this union. We created Living Whole Online to give you the tools to explore what a holistic, integrative whole health approach can do to help you care for yourself. Our facilitators in Living Whole Online's education programs are seasoned professionals offering you ways to care for yourself so that you get fired up and teach yourself skills that improve your health and give you more joy and peace in your life. These expert colleagues are trained in conventional medicine, in whole plant-based food, in the movement of the body, and in what we call mind, body, spirit disciplines, which include family connections, energy practices, and the creative pursuits that lift our souls and help us heal, including art, music, writing, photography, and filmmaking. All of our facilitators have the perspective that an integrative whole health approach to our self-care is important for our health, the health of planet Earth, the health of animals, world hunger, and thirst. These are the colleagues you will meet in November and December when we first launch our new Living Whole Online programs. There are more to come, many more to come in the months ahead. You can look forward to Sundays when new programs will be added to our website that will give you fresh ideas with which to start your week. We offer our educational services in 2 ways. One is through recorded videos like this one. We are a global community and we don't want to be constrained by time zones. You can watch our videos when it is convenient for you. The other is through live with facilitator programs, both in groups and in individual sessions. The richness of your Living Whole Online explorations will be enhanced by your experience with our facilitators, and I invite you to go to our facilitators page and read each biography. These facilitators are teachers who inspire us, who light a fire of excitement within us, who teach us what they themselves have been excited to learn. They're enthusiastic and passionate and have creative ways to share with us what they have discovered and want to pass on. In addition, I have a series of podcasts with some of the facilitators. It's called Please Continue, I'm Listening with Dr. Kathryn Hayward. As you explore our website, you will see the term tapas. I live in Spain, and tapas are bite-sized plates of food. In Living Whole Online, tapas are bite-sized plates of learning. If you feel that your plate is too full, if your hands are holding too much, if you're holding too much on your shoulders, our Living Whole Online tapas programs will help you unload your plate and free your hands and shoulders. If you have health challenges and worries, try our TLCs, which are short for Tapas for Life courses. TLC also means tender loving care. You're giving yourself TLC, tender loving care, when you take a TLC, a Tapas for Life course. If you're healthy and want courses to enhance your health, check out our Tapas a la carte programs. You can find what you're looking for by following the petals of the living whole flower. On my first day of medical school in 1982, I was sitting in an auditorium with a whole bunch of nervous medical students. And the dean of our medical school got on stage and he said, in the next 4 years, you're going to learn 10,000 new words and their definitions. I don't think he was including the definition of doctor when he said that. But over time, I learned that the definition of doctor is teacher. So when I say the doctor is in, I'm talking about the teacher that is within each of us. You have a teacher within you, and that teacher has a powerful voice, a powerful way of influencing you and helping you learn and grow. When I think about what's ahead of us in Living Whole Online, I get really excited. I think about how we can learn to listen more deeply to ourselves and to one another, what we can teach one another, how we can communicate better, how we can collaborate together. I think about all the joy we can share as we experience living whole. I speak for all the facilitators in Living Whole Online when I say to you, thank you for joining this community. We all look forward to being with you soon.